to this Get Real Network webinar. Before we get started, just the usual logistical items. When you log in, please call in by phone and preferably a landline, and preferably not using your speakerphone option. If you have trouble with sound quality or any problems, sometimes it works better to hang up and call back in, and that sometimes corrects the problem. We are recording this webinar, so you recorded version will be sent out later. Next slide. Or not, Lisa.
I'm trying.
Okay, while we're waiting for the next slide, we will be sending out a survey at the end for you, so please fill that out and send it back in. It's very helpful to us to know what you thought about the webinar, and also if you have any ideas about future webinars. And we will collect questions as the webinar progresses, so please use the function to send in questions to us, and we'll capture them, and at the second part of the webinar, we will field those questions. So this is a webinar about the RISE initiative in Los Angeles County. It's part of the Los Angeles LGBT Center. And I'm going to be introducing Lisa Parrish, who will be making the presentation. Lisa has an extensive history working in the public child welfare sector in two of the largest systems in the country, both New York City and Los Angeles County. And in her management positions in those agencies, she's led many system reform initiatives aimed to improve outcomes for children, youth, and families. She's also been a colleague and thinking partner as we've developed our Get Real initiative, and she's currently the project manager for the RISE project at the LA LGBT Center. Welcome, Lisa.
Thank you, Bill. I hope everyone can hear me well. This is Lisa Parrish, and I'm going to describe the RISE project to you today. We are at the Los Angeles LGBT Center, and the RISE project is an initiative that was funded by the Children's Bureau from the Administration on Children, Youth, and Families, from ACF, from HHS, under a cooperative agreement. The presentation I'll give you today quickly will include a description of the RISE project, including the initiative that it was funded under, the Permanency Innovations Initiative, some background, a brief description of the foster youth survey we've just completed, a description of our outreach and relationship building intervention component, and a description of our care coordination services intervention component. The Permanency Innovations Initiative was set up under the Obama administration in 2010. In 2010, there was a notice of funding availability sent out around permanency critical initiatives, which identified specialized vulnerable populations, populations vulnerable to long-term foster care. And LGBT youth were identified as a specialized population specifically in that notice of funding availability. And the Los Angeles Gay and Lesbian Center, in collaboration with other government and private entities in Los Angeles, sent in a proposal in the summer of 2010. And I just want to say that there was clearly no funding initiative like this previously from the federal government, certainly not under the previous administration, and that the Obama administration has been very, very supportive of looking at this issue in the child welfare system. PI itself, the Permanency Innovations Initiative, is a 5-year, $100 million multi-site federal demonstration project. It is a research evaluation project, so each of the projects that are funded have an independent evaluator looking to establish an evidence base for practices that are successful in achieving permanency. There were 6 original grantees, each with a unique intervention designed to help a specific subgroup of children leave foster care children who otherwise would be at risk in foster care for greater than 3 years. And the goal is to improve permanency outcomes and build an evidence base. The requirements of our cooperative agreement with the Children's Bureau are that we follow a particular approach. We'll call it the PI approach. We implement innovative intervention strategies informed by relevant literature to reduce long-term foster care stays and improve child outcomes. To use an implementation science framework enhanced by child welfare expertise to guide technical assistance, to rigorously evaluate the validity of research-informed innovations and adapted evidence-supported interventions, and to build an evidence base and disseminate findings to build knowledge in the child welfare field. The RISE project itself is a 5-year cooperative agreement awarded to the LA LGBT Center $13 million between 2011 and 2015 to design and evaluate interventions aimed at increasing permanency for LGBTQ children and youth in the child welfare system. And it's a collaboration that the LA LGBT Center put together with the county services departments, particularly with 5 large key ally foster care agencies, with LGBT and other legal advocates, and other health and children's services providers, for example, Children's Hospital LA. And we've had a tremendous amount of contribution and support from content experts and consultants, including the Williams Institute at UCLA School of Law and Holarchy. I'll speak about the foster youth survey in a minute. I just wanted to give everybody a minute or two grounding in the size of Los Angeles County. It would be the 9th or 10th state if it was a state in the United States. It's for over almost 5,000 square miles, 10 million population, almost 2.4 million children under the age of 18, and the Children's Services Department, the Department of Children and Family Services, has a caseload of open cases of around 36,000, and there are over 17,000 children and youth in out-of-home care or foster care. I'll come back to kind of the size of LA County a little later when we're talking around care coordination services. And I'll just say this, that the LA LGBT Center is in Hollywood, which is, if you will, kind of right in the middle of the map in SPA 5, Service Planning Area 5. So you can imagine the scope of trying to serve children and youth all over Los Angeles County. I just want to say briefly about how the LA LGBT Center approached the application for this project. There really was a sense that when LGBTQ foster youth and their families were competently identified and appropriately served, that they would achieve safe and stable permanency. And I'm not going to read our whole theory of change slide here to all of you, but the gist of what I want to get across is that even in a large urban center like Los Angeles County, if you will, a blue county in the state of California, a blue state, a liberal state, it's particularly along the coast, there was a very strong sense that not only were there no specialized services available for this population in the child welfare system, even though there had been previously, but that there was still a tremendous amount of bias and discrimination, and that this was still a population very vulnerable to stigma, and a population that still remained hidden, and that there were good reasons for this population to remain hidden. Because there weren't services in place for them, because folks weren't trained and prepared to work with them, and particularly with their families. So really our theory of change was when you appropriately identify and serve these youth, they would no longer be at risk of long-term foster care. In the beginning of the project, when the LA Gay and Lesbian Center, which was our previous name, we changed it just a month ago. So as you can see, I'm still getting used to the LA LGBT Center, saying that instead. Got the 5-year agreement in October of 2010, and really spent the next year and a half as a planning year, We collected and mined information about the experience of children and youth in the LA system. We were very lucky in that we were able to access system of record data for about 10 years of about 400 residents of an organization which no longer exists in Los Angeles, Gay and Lesbian Adolescent Social Services. Everyone knew them as GLASS. And GLASS provided group homes. There was a foster family agency that had a caseload of maybe 25 or 50, and they actually had begun providing preventive services in various locations in Los Angeles. But unfortunately for us, GLASS went out of business in around 2008, 2009. And after that, there were no specialized services in Los Angeles for gay and lesbian, LGBTQ youth. But we were able to get system data about them, child welfare system data of record, and we're even able to do a match with our mental health system data. And the thing to know about that was that these were youth who were placed in level 12 group homes. So there was a criteria of medical necessity of a mental health diagnosis for them to actually be placed in these group homes. So we were very cognizant that this wasn't data that would be representative of LGBTQ youth in foster care in general. We were also able to do 44 case reviews of current and former LGBT youth in foster care, and we did those with our partners. We identified those with our partners at foster family and group home agencies who were working with us in our pilot. We held foster youth speakouts and some speakouts for public and private agency staff to kind of get a sense of the kind of their thoughts on best what was going on with this population and best ways to serve them. We also held an expert roundtable where we brought people in from around the country who were content matter experts, had been long working with this population in the child welfare field, the homeless field, the juvenile justice field, and talked very explicitly with them and some youth who were on the panel as well about the issue of the benefits and disadvantages of identification of these youth, whether as it is a matter of course in a system or in other ways such as confidential identification. That roundtable really led us to believe all the more important for us to go ahead and continue developing different sorts of interventions and to continue with our data mining because it was clear that everyone still felt that there was a great deal of invisibility for this population. There was no clear data on prevalence or experience. You know, the general sense out of all this gathering of information was that some training existed. Not everyone in the system got it. It was not routine or mandatory. This was training for staff. Not even training for foster parents or training for young people in group settings. But there were no evidence-based service models to address safety, well-being, and permanency needs, that there still was a very strong sense that there was system-wide heterosexism, anti-gay bias, and anti-transgender bias, and that there were a lot more to be learned about the intersection of sexual orientation, gender identity, gender expression, and race and ethnicity in the child welfare system, since everyone's sense was that children and youth who were LGBTQ resembled the race and ethnicity of other kids in the child welfare system. So we decided that we would go ahead and work with the UCLA School of Law's Williams Institute and another content expert who's part of our project, Holarchy Consulting, to design and administer a survey to collect information directly from foster youth in Los Angeles about their characteristics and experiences, to examine disproportionality and disparities. And I'm going to show you some data from the survey that we did, which was completed actually in 2013, and this survey is about to be published hopefully in July 2014, this month, and if we don't manage to get a release date this month, it'll be next month. So the survey report has been finalized by the authors at UCLA. Bianca Wilson was the principal investigator, Kush Cooper was a co-investigator, and Angel Castanis and Sheila Nazad were also report authors. It's a very in-depth research report, and I'm only going to give you a few very brief slides showing some of the findings. I've suggested to Bill that this actual report about the findings of the foster youth survey in Los Angeles would be a great webinar in and of itself for the Get Real project, so maybe there'll be an upcoming one of those. We were able to get from the Department of Children and Family Services a listing of 3,000 potential contacts that were randomly selected from youth in foster care age 12 and older, so all the way up through age 20. We actually stratified the sample to make sure that we got a sufficient amount of youth age 17 and older. I thought it was very important that we make sure that we were trying to able to get some data that we could speak to about youth 16 and under and youth 17 and older because of some other data collection that we knew about across the country, that we wanted to also make sure that we were really clear on information about the target population of youth aging out of care. So in short, we got over a period of about 3 or 4 months, 786 responses to about a 20-minute survey, and 19% of the youth who responded to the survey completely identified as LGBT or Q, around 13.4% as LGBTQ, and sort of an astonishing over 5% as transgender. And I'll just say a little bit about both those statistics. There was a higher response rate of girls than boys to this particular survey, which is not uncommon. This was a telephone-administered survey. It was confidential, and young people were able to use touch-tone technology to answer the questions, so for complete privacy around what their individual answers would be. And there was about 60-40 split of girls and boys amongst the total respondents. And in terms of LGBTQ youth who identified that way, the largest pool was bisexual girls. And I just want to say a little bit about the youth who we've categorized as transgender. Some of them, a few of them, identified themselves as transgender, that particular label. Others identified themselves as currently identifying as a gender other than they were assigned at birth. So there's a pool of kids in that particular label, but we felt that it was not a complete surprise to us that both these numbers would be much higher than one would expect to see in the general population. As much as 2 to 3 times higher as one might expect to see in the general population. So there's a lot more of this in the report that's coming. Just to give you a couple other data points about this, I found it really interesting in terms of the age breakdown between the 16 and younger and the 17 and older kids. And you'll see that the identification as lesbian and gay was much more prevalent as kids were older. Identification as bisexual was more common with younger kids. Identification as questioning was more common with younger kids. And the transgender breakout, I'm not really sure what to say about that. It's certainly worth a lot of discussion, but sort of a different age split there as well, younger kids versus older kids. The last thing I just want to say about the foster youth survey is that we asked a number of questions about youth's experience, and there were particular areas where the experience of youth who identified as LGBT or Q differed from those of youth who did not identify as LGBT or Q. In fact, in general, their experience was quite similar, but in terms of incidences of homelessness, in terms of incidences of being hospitalized for emotional reasons, and certainly in terms of reported discrimination related to LGBTQ identity or gender expression, and also in terms of feeling not as well treated by the system, LGBTQ youth reported more of that than non-LGBTQ youth. And you can see, almost 1 in 3 of the 12 to 16-year-olds who identified as LGBTQ reported discrimination related to their identity or gender expression, and almost 1 in 2 of 17 or older year-old kids reported discrimination related to their LGBTQ identity or gender expression. That's all I'm going to say now about the foster youth survey. We could speak for 2 hours about the data in it. We'll be publishing it soon. We'll make sure that gets posted on the Get Real website. I'm going to move on to our 2 intervention components, which are actually being evaluated by our independent evaluator by the federal government. It was clear that training, and more than training, was needed for the system-wide. So we decided to quickly develop training series for staff, both private agency and public agency staff, and also we began to develop the idea of what could we do to sustain training competency after training was implemented. We hired trainers, we contracted with some researchers and some permanency experts to help us, and we developed a work group to do literature reviews, collect materials, and confer with experts using the implementation science framework, which is literature review, looking for best practices. I have to say here we got a tremendous amount of help from folks all across the country, and we were greatly benefited by looking at the materials that others were using in other sites across the country. And in particular, I want to give a shout out to the Bay Area. We were given the Bay Area Youth Coalition developed curricula that was developed in 2007 by Jill Jacobs and Shannon Wilbur, Jody Marksmer, and Caitlin Ryan. A shout out to Brandy Nicole Brooks in Washington, D.C., who let us look at the coaching and mentoring curriculum that they were using and had developed. It was really remarkably helpful. We certainly looked at things like Moving the Margins, the NASW, Lambda Legal curriculum by Diane Alza, and others. And it was just really a group effort, and really the message that we got from folks all across the country. I also want to call out the True Colors information that we got. Was don't recreate the wheel. There's a lot of this that's been done out there. It's happening in various places across the country, and so we really used other curricula to create our curricula. It was around the same time that the HIV Law Project was creating the Teen Sense document on standards for model standards for training for staff around LGBTQ youth and systems of care, and so we certainly looked at those as well. So we really didn't want to recreate the wheel. The strong sense we got was that what would exist was effective. We wanted to put together a version for Los Angeles, but we also got the strong sense that it wasn't enough simply to go in and train people. So we ended up designing a kind of multi-part intervention, which was an organizational level intervention. And we called it Outreach and Relationship Building. You'll hear us use the acronym ORB a lot. It's just, it's a cute acronym. I actually love using it. And we have a terrific graphic designer named Brian Miller. And this is Brian's depiction of our ORB intervention. We provide training to public and private agency staff to increase foundational knowledge about LGBT identity and its application within public and private agencies. We have a 2-part curriculum called Foundations and then called Social Work with LGBTQ Children and Youth in the Child Welfare System. And that's a total of 6 hours, and we deliver that to public and private agencies across Los Angeles. I guess it's worth saying here there are probably 3,000 social workers in the 7,000-person Los Angeles Department of Children and Family Services, and there's probably multiple times that at the 60 or 70 private agencies in Los Angeles. We've also developed a monthly coaching network to kind of work with the agencies who go through our training process. We hold a monthly coaching meeting where we come in and we deliver learning labs and booster sessions related to our curricula. And so we've been delivering additional training segments in the coaching network as well on topics like bullying and sexual abuse and LGBT identity. We also, a very strong part of our curriculum is the posting of environmental cues. We want to increase the number of LGBT affirming symbols displayed in public and private partner agencies to promote inclusion, safety, and awareness. And those are the three components of our organizational level intervention, which we hope will result in bringing up the LGBTQ competency of the system in general. I'm not going to read through the slides. There are 6 slides here that describe our 2 curricula, but I included them because I thought particularly for all of you, you might really want to see what the gist is in terms of our learning objectives and our units in the curriculum. We will be giving Get Real the most current version of our 2 curricula to post. We're right now in the middle of finalizing it for resubmission to our Institutional Review Board, which has to review everything. But we'll probably get that to Get Real for posting, I hope, by the end of the week. Worst case scenario, by the end of next week. So I haven't read through those learning objectives and curriculum units. You can look at them yourselves. This PowerPoint presentation will be posted as part of this webinar at the Get Real site as well. I just wanted to give you a sense of the environmental cues that we're distributing as part of our training. We have a Brave Space poster. We spent a lot of time thinking about what this should look like and getting a lot of input about it. And I'm going to tell you a brief story. One of the agencies that we're working with, which is an agency called Penny Lane Centers in Los Angeles, a very large agency, had posters all over their group home and their administrative buildings. And one holiday season, I guess it was last holiday season, they had a young person who was very upset who ran down through the administrative building tearing down holiday decorations and tearing down other things that were posted, and literally stopped in front of the Brave Space poster, looked at it and moved on and didn't tear it down. And I just think that story is hilarious. Another pointed little story that I can tell you about this, we have another agency that we work really closely with, Hathaway Sycamores, and the youth there have had input into where to post the posters, and they have their own kind of patio space where they hang out, and they actually have taken to calling it the Brave Space and have really gotten on board with the idea of brave spaces and courageous conversations. We also have, we give folks stickers and portable cues, and we really emphasize in our curriculum the importance of outreach. This is an outreach mechanism, the posting and sort of display of indicators that you are open to conversations about LGBTQ identity. And I'll just say this, we got a lot of feedback. The center runs homeless youth programs and has for 40 years, and in our homeless drop-in center upstairs where we tested a lot of our materials, we got a lot of feedback that, you know, the rainbow symbolism was really the best symbolism to kind of signal that people were LGBT or allies. I'm not going to talk about this at great length, but as part of our implementation science framework, we do fidelity assessment very carefully. We're doing fidelity assessment on our training series by videotaping every training that we hold. We videotape the trainers, not the audiences. And then we have outside consultants who are fidelity reviewers review randomly selected trainings and rate our trainers on instruments where we've come up with various domains that we'd like to see demonstrated in their training. And we do that, we rate basically 2 trainings per trainer a month. We have 5 trainers altogether. We have a twice a month coaching session. We call them actually performance work groups. And we also have internal professional development sessions. There's a lot of peer-to-peer coaching amongst the trainers. We bring in some clinicians to help with coaching. And we also have our trainers attend our external coaching network meetings, because there's a lot of sort of peer-to-peer coaching that goes on in there. And then the fidelity review and the coaching sessions are integrated into supervision of the trainers. who developed the intervention. And so we are training, we are videotaping, and we're watching lots of videotapes to make sure that the trainers are delivering the curriculum with accuracy and with competency. Our training series is being evaluated. There is a pre-test before the first of the 3-hour curricula. There's a post-test afterwards, and we are just about to implement an additional 2-month later web-based survey to get at application in the field. So the pre and the post-test are really about knowledge acquisition, individual knowledge acquisition, to see if there's a difference between the pre and the post-test, and the web-based survey will be, has this information been useful to you in your work over the last few months? We have an independent evaluator, Westat, who are doing all the data collection here and the data analysis. We don't do that ourselves at RISE. We have a coaching network, and I described it a little earlier. We meet once a month. We've got about 60+% of our agencies that we've trained participating. Our goal is to have 2/3 of the agencies participating. You remember how big Los Angeles is? We have agencies in the Antelope Valley who are basically 2 hours away from our site in Hollywood, and they don't come to our training network meeting, our coaching network meetings. But we have a goal to increase the participation in our coaching network, and this is kind of our expansion plan. We've trained about 15 agencies so far, and our target is about 30 by the end of the project, but we may well exceed that target. Let's see. We've also just developed and started implementing a pilot foster parent training, which is 90 minutes, and we're doing our pilot in both English and Spanish. There are a lot of Spanish-speaking foster parents in Los Angeles, and about almost 50% of the county population is Latino, so that's very important. I don't have a lot to say about this right now. We're actually not evaluating it yet. We're going to see how the pilot goes. You all know how many issues there are related to getting foster parents to show up for training. So far we've trained about 50 homes, and we're just going to keep going, testing. We're in a kind of testing phase for our curriculum. I'm just going to move on quickly because I'm mindful of the time. I'm going to speak a little bit more about our care coordination services. So this is our second intervention component. It's our child and family level intervention component. We knew that we wanted to provide direct services to LGBTQ youth in the Los Angeles child welfare system, and we had to go about deciding what those direct care services would look like. We used the implementation science framework approach to kind of do a literature review, see what other people had done. We looked at care coordination, literature review, we looked at permanency, we looked of course at LGBTQ children and youth. And in Los Angeles in particular, we've been very influenced by what's called the wraparound program, which is a child and family team approach, which is very strengths and needs based and family centered, and a demonstration project that is going on currently called residentially based services, where we've applied the wraparound approach in group home care. Our key questions as we tried to design our care coordination test was, would we be doing placement services or more of a community-based approach? And we pretty quickly collectively agreed that we were working with placement agencies as part of our collaborative, and that we did not want to develop foster care placements itself or a group home setting. We wanted to develop community-based services that could go work with families in the community. We quickly decided that we wanted to lead care coordination rather than be adjunct specialists. We really felt we needed to be in control of the decision-making to the extent that we could. Well, of course, the department is in control of the decision-making. And then we really liked the approach of the wraparound team, which was more family-focused, as a team that consists of a facilitator, a parent advocate, a parent partner, and then a youth specialist or youth advocate, versus a team that really had more of like a permanency specialist on it. Long story short, Wraparound is a program where there are somewhere between 800 and 1,000 kids in Los Angeles County enrolled in Wraparound. We hired staff who were experienced in the strengths and needs-based Wraparound approach, consulted key purveyors, and followed the implementation science framework. And I will say, you know, one of the things that we know we needed to add to Wraparound that I haven't focused on here, but I'll certainly talk about, is increasing family acceptance and decreasing family rejection. For the implementation science approach, we had to identify the essential functions of what our care coordination team would actually do. And this may not look too far into those of you who've been involved in practice model development for your agencies. And this is very close to what's articulated for Wraparound in general at places like websites like the National Wraparound Initiative website. So collaborative teaming, engagement, strengths and needs-based practice. We added LGBTQ support and education and expanding family connections as the key functions of what our Wraparound what our care coordination teams would do in service of the goals of emotional and legal permanency for youth. I said a little bit about our care coordination teams. We have 4 of them. There's core members. We also have clinicians and family finders. Our eligibility criteria are kids aged 5 to 19 years old with open child welfare cases. They can be duly involved with the probation system. They can't be in locked settings. And they can transition to our team from other child and family teams. And I just want to say a little bit about how the essential functions work with the phases of care coordination. So, you know, our practice model is that our teams are trained in these essential functions of engagement, teaming, strength and needs-based practice, the expansion of family connections, and LGBTQ support and education. The goal of the team is to grow the family support network or the natural support network around a child who's enrolled, to do family finding, engagement, preparation, and support, to look for permanency resources, and along the way to be measuring the level of LGBT support and to be providing education around LGBT identity, and particularly focusing around reducing rejection, increasing support, and increasing acceptance. We approach our team work in phases. So the first phase is preparation and teaming. Our second phase is engagement. And during the engagement phase, we complete various tools, which will sound very familiar to those of you who are familiar with Wraparound. A vision statement. We map strengths. We do family connections maps and eco maps. We develop a plan of care and a family finding discovery plan. And then phase 3 is really where we're working with the youth and their family to expand their family network, to provide LGBTQ education support. We begin assessing indicators that we've identified of support, and we begin assessing permanency indicators that we've identified. And then phase 4 would be to transition to permanency. I'm just going to say we have the same fidelity approach with coaching and supervision for our care coordination teams. Our fidelity is actually, we have outside consultants who review 1 case per team per month. They do an actual family team meeting observation. They do a document review, and they give a short survey to the youth and to an adult who attends the family team meeting. So it's a fairly rigorous 3-part method of fidelity assessment. And then we actually score not only the team, but the facilitator, the youth specialist, and the parent partner, and the family finder on the work they've been done. We have 26 youth enrolled right now. We began enrolling in November. Our goal is 40 enrolled altogether, and none of our 26 youth have reached phase 4 yet, although a number of them are in phase 3. I just want to say a little bit, they're spread out all over Los Angeles County. The RISE headquarters is right in the middle of the map where you see the cluster of the most dots. And they're in a variety of placement settings. They are in group homes, some are at home with family, some are in foster homes. We have one youth who's currently in need of a placement, and they are spread out all over the county. Our teams are driving north, south, east, and west every day. I'll just say a little bit more about this. We were really lucky. After we began, first we tested our care coordination approach, and then we began piloting it. We went back to the federal government and we said we don't want to just serve youth in foster care, even though the PI initiative was really focused kind of on legal permanency as an outcome. And we were able to get concurrence with the Children's Bureau to expand our focus to children who are placed at home on what in Los Angeles we call family maintenance cases. So we're actually serving kids at home with their parents. This is very, very exciting work. It's fascinating work. I'll also say we have we've only really gotten referrals of kids age 15 and older. I think actually this week we may yet just have heard about an inquiry for a kid who's under the age of 10. But we are largely getting referrals, I'm sure this will surprise many of you, for kids who are 16, 17, 18, and even 19. So we're kind of working hard with the Department of Children and Family Services to unpack that. We're interested in working with kids who are younger in the system. Given that we only have about a little more than a year left, I'm not sure that we're really going to crack that, and I have a lot of thoughts myself about why we're only getting referrals for older kids. I will say we're also getting referrals that so far by and large kind of match the racial and ethnic profile of kids in the foster care system in Los Angeles. But for the most part we're getting referrals of kids who are out and who are older, out to many folks. We have an evaluation going on of our care coordination services. There are baseline surveys for the youth who's enrolled, their caregiver, and a permanency resource if and when that person is identified. There's a midpoint qualitative interview with the young person, and then there will be endpoint surveys, again with the youth, the caregiver, and a permanency resource if identified at about 12 months from the beginning of services. And I rushed through this. I hope I haven't spoken too quickly. We've included contact information. I'm sure there may be questions, so I tried to leave a little bit of time at the end to see if folks wanted to talk about anything more. I have references for some of the works we've cited here as our final slide, and I think what I'll do now is try to slow down my speaking and turn it back over to Bill Betancourt. Bill?
Yes, thanks, Lisa. We have a few questions that came in. The first one, which you may or may not know the answer to, is why did Glass go out of business?
Oh, am I still on?
I hope so.
Yeah. Actually, many agencies in Los Angeles were experiencing financial problems at that time, and I should have said many agencies in California were experiencing tremendous financial problems, and there had not been a rate increase in rates that had been paid in a number of years in California. And in fact, there was a lawsuit going on the part of the trade association for providers in California, which ultimately resulted in a tremendous rate increase, particularly for group homes. Actually, there were even some rate cuts along the way with California budget cuts. So the reasons were financial, as I understand them.
Okay, thanks. Can you talk more about the family finders, and is your approach different for this population?
Oh, great question. Clearly, as we approach family finding, one of the things that we have to do first and foremost is our team talks alone with the youth who's enrolled about who they're out to and who they're not out to and who they feel safe around. And then they talk with them about people they're interested in connecting or reconnecting to or strengthening their connections with. So you can imagine, as we do typical family finding where you're looking at maternal and paternal family searches, that you want to be particularly careful that you're not outing a kid to family members they may not be out to, or they may not feel safe around, or they may not have had any contact with, ever. So that's approached very carefully. There are team decisions. Our clinicians are involved, and clearly, actually, the Department of Children and Family Services, is in charge of choosing, when any contact with a child is initiated. But, there is much more to mapping really who a kid is out to, who a kid feels safe around, who a kid talking with them, never disclosing their identity to anyone they don't want their identity disclosed to, without, of course, there being, a tremendously compelling, presumably safety reason to do so. And let me just stop there and see if I've pretty much answered the question.
Yeah, I think so. That's been very helpful. Can you talk a little bit about the differences, if any, in the work you've done with private agencies versus the public system? Different challenges, different impact, different spread?
It's all different. This public system in Los Angeles, like many others, is under such sort of organizational stress. Caseloads, I believe, are in the high 30s at this point. So there are some ways in which it's been very difficult for a small research-oriented project to get kind of widespread attention. We also were providing training to the department, but it is voluntary, and certainly participation in the research surveys is voluntary. That said, there are terrific people at the Department of Children and Family Services who are very eager to learn more about working with this population and are very, very eager to get their kids enrolled in appropriate services, get their clients. I will say we've got private agencies who have cultures that are much more open to learning more than some others. There are group home cultures which may differ from a foster family home agency culture. It's really been a big grab bag. We've worked with very small kind of 8-bed group home agencies, and we work with very large multi-service agencies. From our perspective, we're really still just testing this idea of a coaching network as follow-up, and what's been great is that some of the private agencies have developed individualized plans for future change that they want to work on at their agencies. So some agencies have been very interested in increasing foster parent training. Other agencies have been interested in us continuing to do work with them around culture of respect and bullying. So the exciting part of the coaching network is that with the private agencies, we're able to work with them one-on-one and kind of customize where they see the need is for change efforts at their agency.
Follow-up question, the training implementation, all that you're doing is paid for from the grant and does not cost the providers additional funds, is that correct?
Yes, indeed. It is free to the department and the providers, and this is very useful since a year ago California implemented a new law requiring training around LGBTQ education and best practices for system stakeholders, system staff stakeholders.
And so as part of your work with both the private and public agencies, are you thinking about how they will begin to resource and sustain this?
Yeah, in fact, we are thinking a lot about sustainability, and I will say for training, we've been in discussions with the department here about 4E training funds being available for private agency staff training. So that's a discussion that we've opened with the department, and we haven't gotten to any details yet, but we're very hopeful that we'll be able to continue to provide training through that revenue source. And the department has been cautiously optimistic about being able to figure that out with us. And I will say we've trained over, well, about 1,500 folks so far in the last 18 months. And we're kind of training about 200 folks a month now.
Great, thanks. Your focus is on permanence. Is there any work you're doing or any things coming up in your work around legal versus relational permanence?
One of the things we did early on with the National Center for Permanent Family Connectedness with Bob Friend, who's the director there, based on the work that Kevin Campbell did in Family Finding, was come up with an actual set of indicators to measure of emotional permanence. And in fact, we've had discussions from the beginning with our federal partners about our view of the importance of collecting, documenting measurement of emotional permanence, and our suggestion to the federal government that this be another permanency measure that they work on measuring beyond legal permanence. And I think that we're really, this is experimental. We'll have more to say once we've got some kind of follow-up surveys done for the first 9 kids who we've collected baseline surveys for. But it's fascinating work. We'd be happy to share our emotional permanency measures with any of you. Bill, we could get those posted on the website as well. And it would be a great topic. For us, the kind of interesting intersection is emotional permanency and LGBTQ support, LGBT support. We want to see both in the families that we're working with, and we're measuring both.
Great. Another question, do all the youth and family support partners themselves identify as LGBT?
All of our youth do identify as LGBT or Q. Those are all the youth who are enrolled, and we have 26 so far, and we've got an additional 17 referrals that are going through the referral process. The family support partners, I'm not sure what you mean by that.
Well, I didn't ask the question, so I'm assuming perhaps the team that's working, it was around youth support partners and family support partners is what they were asking, I believe.
Yeah. So let me talk about the team.
So probably the team members.
Sure. So we have a mix.
Support.
We have a mix of folks who identify and folks who are allies. I mean, here's an interesting thing that we've tried. We initially recruited parent partners who had LGBT children and some experience with the child welfare system or mental health system, which is what our criteria for a parent partner is in the wraparound model, not having children who are LGBT, but the latter. That's been really developmental, and it's actually been hard to find and sustain folks and to train them. So that's an element of our model that, again, we're testing. This is all an experiment. Our youth specialists are all LGBT. Our facilitators and family finders and clinicians are allies and LGBT people.
Okay, thanks. What criteria are used to decide if a referral will result in enrollment in the project?
Oh, what a great question. I know why Bill's laughing too. We've tried to keep our eligibility criteria really broad. And I don't know if there are others of you out there who've experienced this, but many new programs that I've seen introduce, the eligibility criteria really preclude a lot of participation. So we tried to keep them really, 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 really broad. and our biggest sort of setback is if a youth is enrolled in another family team program, so because there can't be double dipping for family teams, even though our family team is 100% federally funded, but there really can't be two different teams both leading care coordination. The other big setback is if the youth is in a locked facility. And there are some locked facilities in Los Angeles. We have some youth who enrolled who are dual status, which is great, and we are very hopeful that we can really intervene well with both our DCFS partners and our probation partners. Bill, what was the question again? It was a really good one.
Criteria used to decide if a referral will result in enrollment.
The big issue that we have with referrals, there's a couple of things. One, obviously participation is voluntary, so the youth has to want to participate. The second thing is that this is a research project, so there needs to be an assent by a kid and a consent by a parent, unless we determine it would be detrimental for the young person to approach a parent for a research consent, in which case we have the opportunity to go before a judge and ask the judge to give permission for a young person to participate. If the case is actually an open child welfare case that's not a court case, and we have some of those, we can get parental consent directly from the parents. It's been a really slow process getting parental consent, for the most part because parents are non-responsive for kids, many of our kids who are enrolled. So we wait a certain amount of time to try to get a response from a parent, and then we go before a judge and ask for the court to grant permission to participate. But I'd say probably 90% of the kids who have been referred have been enrolled. It's just taken a while.
Right. Lastly, and you've kind of been talking about this anyway, but are there any other challenges or lessons learned you'd want to share with folks at this point?
Well, I think it's worth me saying just a little tiny bit about the fact that we really approached this project as a collaboration in Los Angeles, and we were collaborating not with the departments of Children and Family Services and Mental Health and with the providers, the foster care providers, but we're collaborating with the children's attorneys, California, the Children's Law Project of California, and providing with the parents' attorneys, which is an organization called LADL, Los Angeles Defense Lawyers, or Los Angeles Dependency Lawyers, excuse me. And we really got into deep debates about parental consent and whether or not that was appropriate for this population, given that, first of all, they were, for the most part, abused and neglected children, who were adjudicated as abused and neglected, and second of all, because they may or may not be out to their parents. So I'll just say that this was really a huge, lengthy discussions that we had with different parties, including ultimately juvenile court, who had to give us approval to go ahead and do this project, and of course our institutional review board, the California Committee for the Protection of Human Subjects. So there's really a lot about the safety and the human subjects protections for this particular population that turned out to be very complicated for us, given the extent of our collaboration with the parents' attorneys, the children's attorneys, the court, and others. And you know, I could talk about this for probably 2 or 3 days nonstop, but I'll just point that out as one of the kind of biggest challenges that we face that I think we really underestimated.
Thanks. I think it's an important one to note. And you're right, it could be its own webinar. Lisa, thanks so much for pulling this all together and sharing this. I would imagine a year from now we'll probably want to come back and revisit and see where things are at with you. And we will be continuing to work with you around the survey and developing a webinar once that's finished and published. So thank you so much. And thank you, everyone.
Thank you.
Okay.